in one. So I know I have seen that we have more joining us, so that's great. And we're going to do those small group introductions. And our hope is that you could introduce yourself by name, your pronoun if desired, and your organization. And we'd like just to have a brief opportunity to discuss what's front of mind in your work at present. And so the purpose of these small groups is just to help us to continue to build relationships out across the network. So momentarily, I believe you will find yourself in a small group, and I'd ask you to introduce yourselves to one another and focus on that question. You would think after all this time I would know how to unmute myself, but here we are, we're back together. I know that was far too short an opportunity, but we are now going to hear from Caregivers Alberta. And I believe that people can see the screen and that I will stop sharing momentarily. I'm having a technical issue, but
I don't think you are sharing right now.
Oh, good.
Yeah.
Excellent. Well, then we don't have a technical issue. We're going to hear from the Senior Ambassadors Program, and it's Daryl Gregory and Carol Alves Cornell are going to share some information with us on that program.
Yes, thank you, Anne. Carol is going to do the heavy lifting on this presentation. I just want to say a few words by way of introduction. As the ED of Caregivers Alberta, I think this is one of the first meetings that I joined when I joined last October, and there was an opportunity to join this group for a meeting. That was one of the first things that I did. And so there's lots of people who I think I don't know still in this group. So you know, when I was at the MS Society, we created an ambassador program there that was very successful for us during the 15 years that I was there. And that was actually modeled right across the country in every division of the MS Society, because it has such tremendous opportunity to increase your leverage and scale and spread to communities right across the province. And so we had an opportunity to present this a seniors caregiving ambassador program to Alberta seniors, and they liked it and they funded it. And so we have a 3-year project now to support senior caregivers in Alberta. And Carol is going to talk about you know, some of the more specifics about recruitment and training and what the program looks like. So I'll hand it over to you, Carol.
Okay, sounds great. Thank you so much, Daryl, for that introduction. And so I'm going to just share my screen. I have a few slides to put up, and so I'll just make sure here, and we'll put this up. So can everyone see the screen okay?
You bet.
Okay, wonderful, terrific. Okay, so again, thank you so much for this opportunity to speak to this group about our new senior caregiver ambassador role. I think I'd like to start by quickly giving an overview about Caregivers Alberta and why this volunteer role is so important for both our day-to-day work and also for senior caregivers living across the province of Alberta. So we see caregivers all the time, and more than likely, a few of us in this virtual room here today fit that demographic as well. But we don't always understand how caregiving affects us and the care of our care recipient. So did you know that this unnoticed, unpaid caregiver workforce saves the Alberta economy close to $12 billion annually? And that's about $32 million per day. But what about the true costs of caregiving for the people doing the caring? So here are some of the impacts we see in our work that can affect not only the caregiver, but the care recipient as well. Caregivers are often unrecognized, and navigating complex health, personal, emotional, and social challenges on their own. So this is why Caregivers Alberta exists. We are a registered not-for-profit and charitable organization. We were founded in 2001 by caregivers who recognized that while there were supports for caregiving, most focused on the care recipient only. So the founding members identified a need for supports that would focus on their personal needs as caregivers. And our work here at Caregivers Alberta is about the caregiver, that journey, that well-being, and how we can support them. So when caregivers are not supported in their role, they run the risk of becoming the next patient. And then the question becomes, who will now care for that care recipient? So as Alberta's only dedicated caregiver organization, we improve the lives of Alberta's caregivers by providing group and one-on-one supports that help caregivers connect with others, which is so important to have that peer experience and peer support. We help them to navigate the system and also to look after themselves while providing care. We work to enhance their caregivers' skills and abilities through education and support. We work on increasing a community's capacity to support caregivers by educating professionals and workplaces, promoting networking and referrals, and sharing of programs. And we also advocate for policy changes that will make a difference in caregivers' lives. So to that end, we are developing this very important role, the Senior Caregiver Ambassador role. So ambassadors will help us connect with senior serving and other community organizations across the province, while also connecting directly with senior caregivers to create referral pathways and build awareness of the programs and services that we have available. Our hope is that this will increase the number of senior caregivers reaching out to us for support in their caregiving journey. Senior Caregiver Ambassador volunteers will have the opportunity to use their past experiences and knowledge to network and connect with people and organizations in their communities. Ambassadors will operate within one or more of the general skill areas you see up on the screen now. But I want to stress that ambassadors don't have to have a very specific resume or professional skill set, or even lived experience as a caregiver to volunteer in this role. We welcome anyone who recognizes the importance of our work, who believes in what we are trying to accomplish, and also who just wants to help caregivers. We will provide training and support throughout an ambassador's time with us, and that will be designed to build that confidence for networking and connecting with peers and community organizations and decision makers. Ambassadors will also have access to printed materials and other resources to help them in their role, and will have opportunities throughout the year for ambassadors to connect with each other, to share about what's going on for them or any challenges they are encountering, and just to really feel fully supported in their role, speaking for and networking on our behalf. And if I could just expand a little bit on who would be a really great fit for this volunteer role, one of the things that we do require is that senior caregiver ambassador volunteers are 65 years of age or older. And that is just to fulfill the very specific mandate of seniors serving seniors that we have for this initiative. Communication skills, lived experience, these are great assets to have, but as I mentioned, we have flexibility there, and training will be provided for whatever type of role that ambassador will fulfill, like the storytelling skill area or the fundraising skill area that you saw on the last slide. The same goes for that networking piece. Volunteers should have some comfort and willingness, of course, to take initiative and create connections and conversation. But we will have training to support them in that work in order to build that comfort and confidence as well. So what's next? Well, we are currently accepting expressions of interest as we've been participating in events in the community and having discussions with other organizations. We are already starting to gather names of people who are interested in volunteering in this role. So I would encourage any of you that are here, that potentially want to volunteer or know someone who would be a great fit, or want to share about this volunteer opportunity within your own organization or network, please do so. Here's the contact information that you can share. Feel free to get in touch with me directly as well. If you would like for me to come and share about this role with your organization or clients, I am always available for a chat or presentation virtually. If you are in Edmonton or surrounding areas, I can be there in person too, and would welcome the chance to do that. We anticipate beginning the really formal onboarding of volunteers towards the end of summer / early fall, with training occurring in the fall. And then from that point, ambassadors will begin going out into their communities and doing this work. So that's it. That's the presentation there. Thank you so much again for the space and time, Sheila and everyone at Edmonton Seniors Coordinating Council and all the members present here today. Thanks for giving me this space to talk about this with you today. And if you have any questions, I'm available, and Daryl is here on the call still as well too. So just let us know.
Are there any quick questions? Again, I think our primary intent here was to create awareness and to let you know how to connect into Carol and Daryl, but we have always a timekeeper. We have a minute or two if there's a few questions. Cheryl, I can see your hand is up.
Yeah, thanks, Carol. I had a quick question about further timelines. So you've told us when I guess it's going to be launched. How about continuing? If people miss this opportunity to kind of raise their hand or be identified on your current timeline, what will happen 6 months from now, for example?
For sure. We see this role being an ongoing role with Caregivers Alberta, and we are currently building out, that training piece and what that looks like. Volunteers will be able to come on board and serve as ambassadors at any time throughout the year. So we will arrange training in that if they're not part of this initial intake and sort of this, I don't want to call it a pilot, but this initial intake and kind of disbursement of ambassadors into the community, there will be opportunities for volunteers to sign up throughout the year and then receive training at that point and then begin their work at any time of the year. Yeah. And
I can see Tatiana has her hand up.
Yes, not necessarily related to the ambassadors program, but maybe. Carol, I'm wondering, what is the main pathway for people to find out about your organization? What's been the most successful, how people get connected to Caregivers Alberta? Maybe it will help us as well, kind of to spread the word about this new initiative and Caregivers Alberta in general. What's been the most successful way to connect caregivers to Caregivers of Alberta?
That's a great question, Tatiana, and I might throw that over to Daryl. I'm new at Caregivers Alberta, but he's been around for a bit longer than myself, and he might have some ways that would be best to connect. We have a variety of ways. Our website, we have an intake line, but Daryl, maybe if you want to expand on that.
Yeah, I don't have much to expand, but I think, primarily through our website, and then people can always reach out to me. I make myself accessible for everybody who wants to reach out to our organization. So, I think there aren't any formal mechanisms, Tatiana. It's just, giving people access to our website. And, if we can get them connected with Carol or myself, we can then have a discussion about where they might fit and what they might be interested in terms of any volunteering. So
I think Sophia, is your hand?
Yeah, my hands are up. I'm just curious, what about volunteers who go and visit seniors in hospital or seniors home, providing social support? That's one question. The other is I really like the idea of story sharing because it shows, what it involves, caregiving involves, because I have a couple of people in mind. So this is really fantastic. And the main question was that, do you consider these volunteers who are providing social support as caregivers?
Yeah, we have talked about that a little bit, Sophia, in terms of sort of a friendly visiting program, and that's something also that if we do, we might model that after the work that I did at the MS Society, because we did have a friendly visiting program there, which was very simple, but it was very profound. And so it is something we're talking about in terms of because that would provide respite for the caregiver, which is our main goal, right? As Carol said. So we're interested in supporting the caregiver. So yeah, it looks like you have a follow-up.
So would they qualify to get the training? Would you consider them as caregivers, or just because in a way they are, and they can bring you stories and stuff like that?
Yeah.
Just wondering if they'll qualify for any kind of training.
Yeah. Possibly, we haven't thought about that part of it yet in terms of that friendly visiting program. So let me think.
So that's why I'm curious.
Yeah. It does, because it does require another level of training that we have not discussed yet as part of this program. So that might be an add-on maybe in year 2, but I don't think we're ready to do that right now.
Okay.
So I know Sheila has her hand raised, and then there's great energy and interest in this subject, and I'm sure it will be a continued conversation. But after Sheila's question or comment, we'll move to our next presentation. Sheila?
Yeah, I was just curious if you guys are posting like the opportunity on some of the volunteer management sites too, to try and encourage people. It's another potential way of getting some volunteers.
Absolutely. That's a really good point, Sheila. Yes, we will be doing that. We're not currently, because we're still building some of those training pieces in that process for how volunteer ambassadors kind of will come on, be onboarded, and then be trained, and then how they'll go out and do that work and what some of those metrics are. But that is the plan, is that then we would have widespread recruitment messages for sure through our website, through any of the in-person events that we attend, and then as well, yes, using online platforms like Volunteer Connector, etc., Charity Village to share about the volunteer opportunity for sure. Thank you for bringing that up.
Well, thanks very much, Carol and Daryl. And we have their contact information. And I think this presentation is primarily to seed the conversation and to create awareness. So offline, outside of the gathering, we hope those network connections continue. So now we do have a second presentation. We're going to hear about emergency preparedness using the seniors lens. And we have, I believe, I've just met them, but they are known as the Kims. We have Kim Savard and Kim Brundrett from the Vulnerable Older Adults Program, and Bonnie Lewin from the Calgary Emergency Preparedness Agency. And just before they start their presentation, you will see that this will be a discussion group later in our agenda. So we'll be able to hopefully have further discussion and questions. Both Kims are able to participate in that group, so there'll be further opportunity for conversation later in the agenda.
I'm just really happy I managed to share the screen. I was stressed, and usually you can tee it all up before the presentation. So thanks very much for having us. And the other Kim is going to start us off.
Sure, thanks, Anne. And you did a great job with my name. Most people do not, so thank you for that. We're excited to talk to you about our project today, and we'll get started right away with Bonnie, who is with the Calgary Emergency Management Association, and she'll give an overview of how Calgary handles preparedness and their work with community organizations.
Thanks, Kim. So Kim, if you want to flip to the next slide, she's my Vanna today. So thank you very much for having me today, folks. So really what we would like to share today is how the Calgary Emergency Management Agency kind of organizes. So this is just a big information for you is that we are connected throughout the City of Calgary. It's not just the City of Calgary Emergency Management Agency that does response activities. We reach out to our businesses, to our nonprofit organizations, and how we handle a response. So just to give you an insight of that, we have other connections, and it's not just about the City of Calgary. Next slide, please, Kim. So what's the role in emergency response? So really it's about the connections and how do we support our community and our partners, understanding what are impacts to our communities and population experiencing those vulnerabilities. How are we supporting them if we're asking folks to evacuate? I like the conversation around caregivers. That's definitely another avenue that I've been thinking about in my role as emergency social services. Because we open the doors and support people who've been evacuated. And again, they're the most vulnerable. During the 2013 floods, we did have some of our older adults that were in our reception centers, and we certainly could have used some support from the caregiver piece of that, just to support our emergency social services members as well. So definitely like that conversation that you're having today as well, and appreciate being invited to join you today. But the one piece that I am going to mention is how the City of Calgary offers our nonprofit organization liaison role. So Kim, that's the next slide. So how we do that is the reason we have a nonprofit organization liaison role in our emergency management structure is really a central point of two-way communication and coordination between the city and our nonprofit sector. So that is coordinating the information and liaising with those nonprofit organizations to provide services to our most vulnerable during the disaster. But also it was identified that our nonprofits in the City of Calgary work with our citizens before the disaster, during the disaster, and then after the disaster as well. So really having that connection and understanding of what's happening in the City of Calgary. Those linkages with our nonprofit organization liaison is about preparedness strategies. So Kim on the line, when she was working with an organization in Calgary, we worked closely together to help build those preparedness strategies and build the nonprofit organization business continuity planning, those information sharing, right? It's so vital that we can share that information going out. And situational awareness as well. And during COVID, we met with a few nonprofits in our community on a monthly basis, just to have that confirmation, what's happening in the community, what information does the City of Calgary need to know, how do we support our citizens in the city, and then facilitate those connections. So secure resources, any services, and then how can we support our emergency social services? Again, emergency social services is the response. We're providing accommodation, food, clothing, those types of things to our citizens who've been evacuated. So Kim? So this is just another diagram that we have to show how it's structured here at the City of Calgary through the Emergency Management Agency, the other bubbles I showed you. But really what we're looking at is our most vulnerable population focus that we have. And the little bubbles on the bottom is what we reach out to our critical service provider group. So those nonprofits in the City of Calgary that can support during a response, the emotional wellness, the lodging, food, medical, cultural, accessibility, pet care, and recreation. And so a piece of that is our older adult community as well. How are we best supporting them, giving them the information and sharing that information with them? And then you can see the NPO liaison in the red little bubble under community is the one that has the connection with this group. So it's not myself, but I work very closely with our NPO liaison and sharing and gathering that data. Next slide, Kim. So this is just an example of the organizations that we have under the one bubble of emotional support or wellness, and we call them our emergency wellness response team. So these organizations are a subset of our critical service provider group, which is another 40 agencies that we work with. So these folks here, we would call them out when we have a situation or a disaster. We're responding for emergency social services to really focus on the psychosocial wellness of our individuals that are being evacuated from the community. And you can see we have a great connection with our Calgary Seniors Resource Society, as if we have a larger population of older adults, we'll reach out to them for additional services. They work with the folks in the community. Our Calgary Counseling Center to provide that additional support that may be needed. So a variety of organizations that we work with, and it was the emergency wellness response team that just started long ago as our disaster mental health team, and we've now evolved into this group. And then the MPO is also responsible for our critical service providers. So again, this is just an example for you of the previous slide, Kim, of the variety of organizations that we work with as well. So the slides will be available to you. I have to jump off right at 11, but Kim and Kim are going to share their experience in their program as well. So if you'd like to reach out to me, at the end of our slides is my email as well. But just to give you an overview of how we've structured and how we have support in our community. Thank you.
And thanks to Bonnie for being here. I know it's her day off, so thank you very much. So the two Kims, Kim Savard and I, are just wrapping up a year-long project where we've been working to support disaster and emergency preparedness for older adults and their caregivers, with a bit of a focus on older adults who are at risk of going missing. We have started a group on Core Alberta, and we really want to avoid duplication of resources and also bring together resources from other places around the country and other countries as well. So we know that older adults are at greater risk during a disaster. They may have issues around mobility or sensory issues, eyesight or hearing, or cognitive issues that puts them at greater risk. And planning in advance also helps them feel more in control of what's happening in their situation, and lets them engage more in their own planning. Technology can also be an issue for older adults, for sure, during a disaster, which can make them more vulnerable as well. And as we know very well, disasters in Alberta are increasing the number, frequency, scope, and scale and complexity. We know older adults and seniors are more at risk. And we really wanted to take a collaborative approach in working with community organizations around Alberta to kind of fit into what they're doing and just support them in whatever way works best for them in approaching disaster and emergency preparedness.
And so this project is, and we are wrapping it up. We've got about another 3 weeks to get a report into the government, and we're looking at some sustainability. But one of the tools that we have been using in this project is a workshop that we call ePrep. And so I know some people on the call have taken this workshop. So this workshop was developed in partnership with Alberta Health Services after the floods. And when we recognize it actually started based on a recognition that we weren't really preparing our older adults very well for disasters. So because there was a disproportionately large number of seniors that were displaced in the floods, we recognized that we needed to do a better job at preparing our older adults for disasters. And so we developed this 2.5-hour facilitated workshop in person. That was an in-person workshop, and it's a little bit different than some of the other preparedness workshops in that it has a fairly significant psychosocial component. And what we did is we started this workshop. We started doing it with older adults, and then it expanded over the years all across Alberta to all ages. And we used it quite a bit as a recovery tool as well. We spent some time up in Fort McMurray after the wildfires and trained their community. And it functioned a bit as a recovery tool for people to process their experience in the wildfires. For this project, what we did was we went back to our roots and went back to the in-person workshops, and we incorporated more of an older adult focus. And the idea was that we would go across Alberta and do these workshops for older adults in the community, with the hope that some of the community leaders would also take it and then take our Train the Trainer program. And so what we did have, as we're wrapping up the project, we did do 19 workshops and we had 267 participants. That was the one in-person one. And then in parallel, Alberta Health Services continued to do the virtual workshops. And they had a large uptake because of our connection with Alberta Emergency Management Agency. And as Kim said, it's all about the collaboration. There's not anybody that can do this on their own. And we've been so very grateful for the collaboration with Alberta Health Services. I am just thrilled with our structure that we have in Calgary, working with CIMA and on the nonprofit sectors. We did do a number of Train the Trainer sessions. So we did have 5 Train the Trainer sessions, and we had 33 people trained. And we were, again, sort of all over the community. We were in Cochrane, we were in Sundre, we were in Lacombe and Red Deer and Edmonton a few times. And Edmonton Seniors Coordinating Council did a number of workshops, which we were thrilled to be part of and lead. And I know there's some staff that are trained. We've done some for Caregivers Alberta, which is, you guys are on the call, Alzheimer's Society, Canmore, and, you know, a number of different communities that are now sort of with the plan that they are going to continue offering this on a regular basis for their older adults, which was, again, was our focus for this project. And just for those that don't know, these are the kind of the standard steps for emergency preparedness, which we didn't make this up. We are following best practices. And so it really is about having people know the risks around disasters and emergencies, particularly in their communities. Then make a plan. And what we've incorporated into the ePrep program is a section called Know Yourself, and really know your stressors and wellness strategies, and then creating a social network. And then we move into the making of a kit, and then the specialized kits. And what we have found in being on the road, doing these groups in smaller communities with older adults and caregivers, is that particularly coming out of the pandemic, the knowing yourself, the mental wellness, and the stressors was a huge focus for people. 3 years later, after a pandemic, and for some of the older adults that were, you know, maybe a little bit more disconnected, maybe lost their sort of regular social activities, they recognized that they had to do some work now around sort of getting back to that wellness state. And then the other piece that has been a really big point of discussion in the groups is that social network. So again, as we know, in the early days of the pandemic, how our social networks were impacted by the pandemic. And for folks that didn't have readily access to some of the technology, not being able to go to their senior center, not be able to have the regular group activities had a really big impact on them. And so that we found that was a huge point of discussion. The other thing that we did find in the communities that we were in is a real desire to know what the emergency and disaster plans for their communities were. So where were the evacuation centers? Where were the roads out of town? Where would they find the information? So one of the really sort of added bonuses of doing this work was, there's a group of older adults in a community asking questions to their towns, to their FCSSs, saying, I want to know what's going on. Where's your plan? How can I find it? And different communities have different sort of plans around that. And we saw some really innovative, great things that communities are doing to keep their members informed around disasters and emergencies. And it's ironic that we were doing a lot of this in the workshops in the last couple of months, when everybody was fairly heightened around the wildfires and the smoke, and now there's flooding. So it was really timely for us to be talking about this, and I think people were more motivated to again think about all those things that get themselves and their families prepared for emergencies. One of the big things we do talk about is that you know, your CEMAs and your first responders and, you know, everybody, your communities have these plans around disasters and emergencies, but our focus in this program really is about that individual preparedness and individual preparedness for your own situation and whoever else is in your world. So if you're a caregiver or an older adult that looks after grandchildren, et cetera, to really think through what you need to do for the people in your world. And we kind of use the word, you know, it's your zero responders that are going to be there first. So it's your neighbors and families and friends that are going to be showing up in a disaster and emergency right at the very beginning as those first responders start to look at the big picture piece. So that's kind of our goal out of this, doing this workshop. And it's back over to Kim.
And as we mentioned, we do have a group on Core Alberta, and that will continue after this, our little project is over. And there's links there to the Alberta Health Services ePrep project, in particular for older adults, and other resources. And we'll also be doing some more presentations there as well in the fall. And a couple of the resources that people really enjoyed from this project, I would say. The first is the resource guide for older adults at risk of going missing, which was a many-year collaboration between 14 organizations in Calgary, including Calgary Police, Calgary Fire, AHS, Distress Center, lots of senior serving organizations. And the guide, I think it's about 16 pages long. The goal is to prevent people from going missing in the first place. So what kind of assessing your risk and taking some actions to mitigate that risk. Also preparing for if it does happen. So there's something called the Herbert Protocol in there, which would be a tool that you could provide to police if you did have someone go missing. And then also what would happen that it is an emergency, you need to call 911 right away, and what to do, what will happen when you do call 911. And then the carer card, which is kind of on the left there, has also been super popular. So this would be a card that a caregiver would have and keep in their wallet, so that if they were incapacitated for some reason, a first responder, ambulance, whatever, would know that they are caring for someone and that they need to take action on that.
And we do have some of these guides and care cards that if people are interested, we could get them out to you. We've gone into our second printing, and we do have it translated into 9 different languages, which all can be found on that website as well. All right, and so I think underlying our presentation, we hear from Sheila and crew that that there is some hope that there will be some collaborative work happening in this group around disaster and emergency response for older adults. And so we are going to just leave this slide here as a sort of a teaser to say, you know, how can you come together as a community? What would it look like? This is a sign of or a picture of Calgary Chinese Elderly Citizens Association that did the ePrep and then started to do it in their own community, but it could look like all over the map around things. And again, we've been so just very lucky in Calgary to have such a strong collaborative network with the nonprofits and the city and CEMA, and we truly believe that you have to do this work in between the disasters and emergencies, because it's not time to build friendships when you're under a lot of stress. And my favorite line is that we move at the speed of trust. So it's not my quote, it comes from a book, but you have to build these trusting relationships in times that, you know, it's easy to do that because in the middle of a disaster or emergency, pretty tough to sort of figure out who's who in the zoo and you know, and as Bonnie shows up on her day off, we had the conversation, we do that for each other because we built these long-term relationships around working together, and we do it. And as Bonnie said, Kim and I are going to stick around for the breakout session and answer any questions people have, or talk more, I guess. Bonnie's email address is there as well, so she's quite happy for you to contact her. And then for anybody that's interested in the ePrep workshop, Alberta Health Services will be continuing to do virtual workshops, ePrep workshops, and they will be offering train the trainer sessions going forward. And you can get that information with that email address there. And I think that's it. And I don't think we went over.
It's always a challenge to provide so much information in a compact format. So thanks very much to the Kims and Bonnie. And as Kim was saying, the hope was that this presentation would seed that small group discussion in terms of having an example of both a systems approach to how one can connect to CBSS organizations to support older adults during emergency, but also that frontline work in terms of supporting caregivers and individuals themselves. So sadly, I won't open the floor to questions, and we'd ask you to move into that small group, some tough decisions ahead for people as they look at those 4 choices, if this is a conversation you want to have. And as Kim said, the sense is that this might be an area to focus collaborative action on, and that the network could seed those initial conversations. So I am going to move to our 4th agenda item, which is called Network Action Hubs and Breakout Discussions. And the focus will be to hear quickly from the work that has resulted from some Action Hub initiatives, and then to have our small group discussions. So before I call upon our brief presentations on those updates, just wanted to communicate that an action hub is really the way that this network is the language we're using to say, here's the mechanism we can use to seed conversation, to gather together on themes and ideas that we think have potential for collaboration, to explore them, and then to see if there is appetite to actually move from identifying common interest and some excitement perhaps, to moving forward into a more substantive action. And we have seen in our history 2 areas, coordinated outreach and social prescription, where there was initial conversation within that informal action hub mechanism. And then these initiatives have moved forward, received funding, and now are independent activities. So we're going to hear from both of them very briefly. And again, our primary purpose here is to make sure there's awareness and people know how to connect and follow through if they have greater interest. So I'm going to call upon Shika first, and she is going to share with us some information on the Coordinated Outreach Initiative.
Hi everyone, I'm just gonna quickly share my screen. I just want to make sure the right slide set's up for you. All right. So as you know, over the past 12 months, we've been working in collaboration with a variety of different organizations across the city, around 26, to talk about how to develop a more coordinated approach to outreach. So in the past, there was about 12 agencies involved in running their own outreach services, and outreach is social work or support workers that help to connect seniors to the services that they need to thrive. So really act as the interstitial fluid between seniors and the services that they need. And so over the past 12 months, we've been looking at how to redesign information in a more coordinated way. So how do we connect seniors to the things that they need to live a good quality of life? And how can we as agencies work together to do that, so that instead of each agency having to take on all of that work independently, we can take some of that on together. So that really landed us on a coordinated system. So what's a coordinated system? So I give you kind of a bit of a definition of outreach below, but you can also see that coordinated outreach is a service made up of outreach workers. I'm so sorry, my puppy is losing her mind. Coordinated outreach is a service made up of outreach workers, general support workers, and home support workers from various organizations across Edmonton that work to connect seniors to the services that they need to thrive. And so basically, as you see in a coordinated system, for the user, it's supposed to be kind of seamless. So basically, the user themselves doesn't actually have to understand how to get through the system, and it makes it very seamless for them. But for the we still have the benefit of coordinations. We still have the benefit of a diversity of organizations coming together to kind of help navigate. And we think that diversity of thought leads to better outcomes in terms of understanding seniors in nuanced and different ways. So how does an older adult connect to support? These tools are really still ongoingly built. So basically one avenue is by calling 211. A senior can call 211 and press 2 for the senior's information phone line. And they can share the support that they're looking for, and an operator will guide them to the support they need. Some of the benefits of that is they can actually directly triage into the system from there. So let's say they need we realize that the work is bigger than what a 211 operator could provide. The 211 operator can book time directly into one of our workers' schedules, and then that worker will have that calendar appointment right in their system to know when to follow up with a senior. So it makes it a lot more seamless for the senior, and they're not kind of wondering, when am I going to call, what's going to happen next, and that kind of thing. The other benefit of this is that they can search by language, proximity, and any cultural or social needs and accessibility needs that the senior might have. So let's say they want to meet at a local senior center, they can look at who's the worker that's closest to that. They can also look at, some of the other needs or interests that that senior might have, like say they have a particular language need, that can be addressed right up front. So it offers a lot of opportunity for the senior to get the support that's best suited to them. The other mechanism that a senior can access support is actually directly through the agencies themselves. So as you can see, we've listed the agencies over here. So they are Assist Community Services Center, Bent Arrow Traditional Healing Society, Edmonton Mennonite Center for Newcomers, Jewish Family Services Edmonton, Multicultural Health Workers Cooperative, Operation Friendship Senior Society, Sage Seniors Association, Strathcona Place Society, the Shama Center in West End, Seniors Activity Center. So if a senior is more comfortable just going directly to an agency, they can go in through there. Any door is the right door, and they'll be connected into the services they need, either with that agency or within our system. Just to give you a brief update on home supports for the time being is transitioning into quadrants. This map isn't like fully finished yet, but basically there'll be 4 quadrants available for seniors to go to. The workers are staying the same, they're just all moving to Jewish Family Services, and the phone numbers are largely staying the same, only one number is changing. So for anyone who doesn't know what home supports is a connection to 3 referrals to service providers in our community that can help support a senior's need. So that's usually with things like lawn mowing, personal care, snow shoveling, just things that help them live a good quality of life at home. And so those referrals will continue to happen. They'll happen in quadrants for the next up to a year, maybe less time. And then basically what we're working to transition to is having the ability for any of our service workers in the system to be able to provide these 3 referrals. So when that happens, at that point, the quadrants will disappear and any worker in our system will be able to give the 3 referrals to the person who needs it. And that just means that everybody gets a better chance of maybe getting more detailed care, because we know, for example, with home supports, that this might be the only time that a senior is calling in for support. So instead of having the senior call in and just get those 3 referrals and leave the system, it's an opportunity for us to check in and say, hey, is there anything else going on we can support you with? And we already know through home supports that ancillary needs were coming up. So it will just provide a more directed way of doing that instead of having to pass them on again and again and again. That worker can even just start working with them on some of those needs as well. So it helps to kind of continue that relationship. These are all, of course, big transitions, and I know a lot of folks are anxious about how things will go. It is a soft transition, so we're going to be taking our time to try and do things right rather than do them quickly. And so not every change is going to be made on day one, but I'm here to answer any questions or support any concerns people are having about the new transition. So please feel free to get in touch. I'll leave my email and phone number in the chat.
Thanks, Ashika. So now we're going to move to social prescription, and I will just give the image of how these action hubs work. That before the pandemic and we met in person, I forget the other items that were on the list, but there were 3 or 4 ideas on the list. Social prescription was one of them. There might have been 40 people in the room. We asked people to self-select based on interest, and I think almost 35 people went to social prescription. So from those early roots, we now have an initiative, and Krista is going to share some information about that, just to ensure you know how to connect and find further information about the initiative.
Thank you, Anne. Yeah, so as Anne said, really social prescribing began as an action hub here in Edmonton. And the social prescribing partnership is currently being supported by the Edmonton Seniors Coordinating Council in collaboration and partnership with Sage Seniors Association, Jewish Family Services Edmonton, the Multicultural Health Brokers, Drive Happiness, and Edmonton Meals on Wheels to pilot social prescribing for seniors 55 plus here in Edmonton. The Social Prescribing Collaborative aims to purposefully link healthcare systems with community-based senior serving organizations through an established referral pathway and mechanisms for ongoing collaborative service delivery. The project is being funded by the Government of Alberta and through Healthy Aging Alberta. And as of mid-February, we have launched the referral form and central intake pathway for referrals to begin for the project. And since February, we have had over 200 referrals into social prescribing, which is very exciting. In terms of healthcare teams and connecting with healthcare teams, we've had the opportunity to connect with over 600 healthcare providers across the city of Edmonton. And the referral form and information for healthcare providers has been sent out to about 2,500 providers across the city. And so thus far, we're seeing a huge portion of those referrals coming, about 49% coming directly from home care, 11% coming from PCNs and family physicians, 11% coming from hospitals, and we had 15% transfer in from our previous project, which kind of is building and extending upon, which was our aging and community supports project. So we have had to transition some clients from that project into social prescribing. So that was about 15% of those referrals, and another 14 coming from other healthcare providers within the healthcare system. And so now within the projects, we do have our positions fully staffed, and the staff have been working together to support clients and connect them to community resources. We have the new role of the link worker support, which is a non-medical support role that offers hand-over-hand assistance for clients when they're looking to access services. So maybe they would be going with them to a recreation center or to appointments, or helping them set up transportation to get from one place to another. And so also through the Healthy Aging Alberta initiative, we are in the development stages and in the final, I might add, development stages of the link worker curriculum to support those roles. So we're working on further updates to kind of further communicate the work that's being done across. I invite everybody to check out the ESCC website. We have launched a new webpage for social prescribing for people to get access to information, as well as for healthcare providers to access referral form information and information on how the project works. So I invite you, if you have further questions or want more information, please feel free to reach out to me directly, or you can visit our webpage on the ESCC website.
So we now have heard 2 very powerful examples of what happens when network members get together, talk about issues of common concern, and then begin to think about what is possible in terms of action. So we are now going to move into the discussion as part of our agenda today. I will just get my slide properly up for you. And so the intention here is that we have identified 4 themes. My apologies for having to see all of that. We have identified 4 themes that we think there may be some interest in saying, what can we do collaboratively to begin to build connections and perhaps take action? So you'll see that there are 4 areas identified on the screen, and I'm going to call upon our host for each of these small groups just to give you a bit of a teaser as to what what would be the focus of the conversation, and then I'll explain how you can self-select into one of these groups. But our first area is the Senior Center Executive Director capacity issues, and I would ask, I think Shelley is going to just give us a bit of a one-sentence overview of what will be discussed in that group.
Hi, everyone. Good to be here today. And it's my first meeting in the virtual world here with you guys. In terms of my thinking around the executive director's capacity issues, it's really, I've been here since December. And I think COVID has really had an impact on the agencies. And it's really that opportunity to say, what is it that we could be sharing and working together on from an organizational perspective? So it could be around the funding issues. And it could be, like I've got some questions around waivers, questions around our recovery grants and what we're doing, because I think that would be really interesting. And even some of the evaluation aspects that we're working from the 5 determinants of health, of healthy aging. So those are the kinds of thinking. Although I have to say, when I look at the other 2, 3, and 4, I kind of want to attend each of them as well. So I realize it is a little bit difficult, but I hope those of the senior centers and the EDs will join me in this little breakout room.
And Krista, you're going to be our host for emergency preparedness.
Yes, I will be the host for the emergency preparedness, and we'll just be taking the discussion a little bit further to discuss maybe how we can apply what we've heard and learned from examples in Calgary, and how we can apply those here in Edmonton, or have new thoughts and ideas on how we can support seniors in emergency situations.
And Gemma, the ED of the Edmonton Chamber of Volunteer Organizations, you're going to support resource sharing?
Yeah, we're just going to talk a little bit about a HR shared service that we are developing here at ECVO, and also a shared service that we're exploring that would be using seniors as consultants to support senior organizations with core functions like bookkeeping, HR, communications, and fundraising, things like that. Although, to Shelley's point, I'd really like to be in 1 and 4 too. So don't feel bad if you don't come.
And then Sheila, you're going to support the advocacy messaging discussion?
Yes, and because there was an election recently, we had done a lot of work on identifying some key messages and some graphics, and we think they have continued use, and we'd love to be able to brainstorm with you about how we can keep them going and really get more traction on trying to get more investment into the sector.
So just before I explain the process, so we will ask each small group if they're willing for their recording of their conversation to be shared. So those of you who are having a struggle about which to pick would be able to hear the conversation. Again, the intention is just to see what interest and energy there is around these subjects. So you will see that each of the discussion groups are numbered 1, 2, 3, and 4. And if you would put the number of the discussion group you would like to participate into the chat, we're going to take a 5-minute break while that information is processed. And when you come out after your break, then you'll be able to put yourself into the small group that you've selected. So if you do not understand this process, just hang on and we can help you. But the intention is you simply put the number of the discussion group into the chat, and then we will reconvene here at 11:17 and have 15 to 20 minutes for a conversation to see where is the energy, what might be some of the ideas people want to share around these topic areas. So we'll just give our technical experts time to put us into groups, but I can see some of you disappearing, so I know it's happening. And if for any reason you're not in a group, just hang on, and after everybody is sorted, we'll find you a home.
Just in my group, I'm gonna guess that we're all on the same page.
We got kicked out of ours too, so thank you for everyone from group 2.
Same with ours. Thank you.
I know. That countdown can be brutal. You can see how quickly that, particularly the last 15 seconds go, you think, oh no, we've got time to just sort of close off, and then suddenly you're gone. So our hope today was that these are first steps to further conversation. So acknowledging, you know, that subjects might be new to us and that the time was brief. But if you're interested in continuing the conversation that you were in, or you have an interest in a group you couldn't participate, if you could put the number of that presentation or presentations again into the chat, then the council will follow up and reconvene discussion in the fall. So the intention isn't that these are one-off conversations, but that we see where there's interest and energy, and we use that action hub mechanism to seed thinking and ideas and see collaboratively how we might respond together to things that are of concern and benefit to older adults. So thank you all for that participation. And we are moving to item 5 on our agenda. And this is sharing of village news, which we'll do in a moment. But before we do that part of our agenda, we're just going to have a quick video clip from the council, which has a new mechanism for how we can support each other and share information about our activities. So I'm going to turn it over, I believe, to Megan.
Okay, no, I've got it here.
Thanks, Caroline.
Yep, so I'm going to start. I'll play that right now.
We can't hear it, Caroline.
You might have to share sound, Caroline.
I did.
We did practice this moments before you all joined us, and it worked perfectly.
There's never any judgment because we're glad it's not us.
Sorry, I had it teed up and I enabled the sound, and somehow it disappeared on me. So I'm gonna try that again.
Is Megan Lala. I am the communication specialist with the Edmonton Seniors Coordinating Council, and today I'll be showing you how to submit an event onto our events calendar on our website. So the first thing you're going to do is go on to seniorscouncil.net, and we're going to go over here to our drop-down menus, and you're going to click on News and Resources. Then you're going to go down to Events Calendar. Once you're on the events calendar page, you can see that there are some events on here already, and you're going to scroll down to submit an event. So you can submit events such as webinars, classes, workshops, activities, and more. So we're going to click add a new event. And for our purposes today, we're just going to add the National Day for Truth and Reconciliation as an example. We're going to go National Day for Truth and Reconciliation. And you can add an event description. So this is an all-day event on September 30th. Go down to September 30th and click all-day event. And you're able to schedule multiple events. So if you have a class that's reoccurring, you can schedule that in right here. You can also add an event image if your event has a poster. And you can create tags. So for example, you can put hashtag fundraiser or hashtag lunch and learn, depending on what you're inputting. You could say if your event has been canceled or postponed. So you can also add a venue in here. And if you don't see your venue in there already, you can create or find a venue. And the same goes for organizer details. If you don't see your organization in here already, you can create an organization. And once you're in there, you're in there. So you won't have to recreate it the next time you will go to submit an event. If your event has a URL or you would like to link to your website, you can do so there. And if there's a cost for the event, you can put that here. Or if there's no cost, you can just put 0. So then you would click submit an event. And typically we approve the events within 1 to 3 days, but just give it some time for it to show up on our actual calendar. So if you go back to our main page and you scroll down, you can see our upcoming events. And once we approve it on the back end, your event will be up and running on our website. Thank you.
So this is another resource to help us keep connected and aware of each other's activities. And I know the council would support anyone as they work through using this mechanism for the first time. So if you remember our Village News component, we are asking people if they have an immediate need that somebody might be able to help with, if there's an event you want to share, if you've completed something, any type of news you might want to share. We can use the chat if you wish, but if you put up your hand, then I'd also be able to call upon you to share Village News. So we'll just open our gathering to anyone who wants to share an event or celebrate an accomplishment or has a question. Nancy?
Oh, that was fast. Thank you. So we have our book sale coming up next week, Wednesday, Thursday, and Friday. We're actually open late on Wednesday from 9 till 7. So that's our whole auditorium full of books. And then we close our doors to the public at 4 p.m. on June 30th for up to 9 months. But we have secured some locations, and for the summer only, we'll be doing fitness programs at Rundle Park at ACT Center. And then we will have fall programs, and the staff will be working out of McClure United Church, which is just a couple blocks away. Thanks. Have a good summer.
Thank you. Marla?
Hi, everybody. Yeah, I can't believe we're talking about summer already. So I'm jumping ahead to the fall, actually. Healthy Aging Alberta is hosting a provincial summit that is happening in Calgary from October 10th to 12th of this year. And it will be our inaugural summit. We are looking at having CBSS, community-based senior serving organizations from throughout the province gathered together, along with other allied stakeholders. We have a really good lineup of keynote speakers and breakout sessions, all really around continuing that move to coordinate the sector and help make Alberta one of the best places to grow older. I'm going to share the link in the chat here to register. We do have a reduced rate right now until June 30th. So I would encourage you to register if you are able to. There are also some bursaries available for expenses for people that are in need of financial assistance that way. I'm happy to chat further, and the Edmonton RCD, Jasmine, of course, would also be happy to share any updates with you. Thanks, everybody.
Thanks, Marla. Janice?
Hi, a couple things. August 24th, we're having our big annual open house from 10 o'clock until 3 o'clock. We invite everybody to come out and see all the different things that we do here at Central Lines, have a free lunch, and just have a fun-filled day. Last year, we had over 600 people attending. So that was a great turnout. We hope to have something similar. But the other big initiative that we did this year was to create video of our members telling their stories about aging, what ageism is, and how they have worked to combat that. We have one 10-minute video that we premiered, and then we're going to be breaking it down into smaller ones for social media.
Have I missed anyone? Are there anything else people wanted to share?
I think both Deb and Shelley, I think, are waving
Okay,
that they
great.
have some stuff to share.
Deb, thank you. Deb, and then Shelley.
Just real quickly, on July 8th, we're having a brunch, and we were fortunate enough to get Martin Kerr as a performer. He's a singer-songwriter, an award-winning singer-songwriter who's sold out venues like the Winsphere and the Jubilee Auditorium. So that's really going to be a good event. And it's $30 for members, sorry, $40 for members and $50 for non-members. That's a brunch on the July 8th.
Thanks, Deb. Shelley?
Yeah, I have, there's a position that's open in our agency. It's a 13-month contract. And it's about taking all of our operational policies and procedures, or lack thereof, and working with the other agencies and bringing them up to speed through 3 lenses. One is through Imagine Canada's requirements that we would be able to be accredited in the future, as well as looking at the lens through EDI, so equity, diversity, and inclusion, and the 5 determinants of healthy aging. So if you know somebody who might be interested in this position, it's on our website, it's posted in a number of areas. Please encourage them to apply, and it's 13 months. That's the big one. That'll be a good project for us to undertake. Thank you.
Have I recognized everybody that wanted to share something verbally? So I can be interrupted, but if I don't hear from someone, we'll just move to our final agenda item. And you'll see this is just to connect you to upcoming gatherings. So as Marla mentioned, the Healthy Aging Summit is occurring in October. She has put the website into the chat, but something will be done, we're not quite sure what, to bring together those of us from the Edmonton area who are attending that. So that will be the next gathering. Sheila, did you want to speak?
Yeah, we had been doing a little brainstorming about that and thought that maybe we would just throw out there on October the 10th, maybe we could have lunch together in the hotel restaurant where the conference is going to be held, because I don't think the conference or the summit starts until just after lunch. So if anybody wants to connect there, then let us know, and we'll sit together and network before the summit starts.
So I think the thinking was that many from the Edmonton area will attend the summit, and given all our challenges in terms of time and capacity, it would be great if we could connect that event. And then the next in-person gathering will be November the 24th. Again, if you have feedback on how gatherings are organized, or you have a topic area you think it would be important, or some suggestion for how we could use our time productively together, if you would let Sheila know, that would be perfect. And so I think this does bring our meeting to an end. I know an awful lot of information shared, and hopefully some, I know in my group, both my small groups, both introduction and the discussion group, some connections made where people have common interests. So as I think someone said, it is summertime, so hopefully we'll all have an opportunity for a bit of a break, and we'll see everyone at the summit. And the council will follow up on those discussion groups and bring people together in the fall based on people's interest. So Sheila, I didn't know if you had any closing comments, or anyone else from the council?
No, just really to thank you, Anne, for being our amazing host, and thank you everybody for joining us today. And I hope you have a wonderful summer, and we look forward to reconnecting soon.